Is it a learning issue? Is it a sensory issue? Is it a motor issue? Is it a psychological issue? Is it a communication issue? Or is it all the above? So dyslexia is difficulty with decoding words and lack of phonomic awareness. That's the key thing with it. Okay. It's not writing things backwards. It's really about the phonomic part of the brain's interpretation of converting words into sound and then to sentence and then to meaning. In children with dyslexia, the key thing with them is that they're diagnosed as soon as possible and they're taught how to learn and their brain is supported during their neurodevelopment because they have to completely change the way they process language. This used to be a huge problem generations ago where no one really understood what dyslexia was. But now people are more aware of it, teachers are more aware of it, parents are more aware of it. So it's easier to diagnose. So there's also rapid naming dyslexia, and many of these co-occur with each other that struggle with the ability to rapidly name colors, numbers, and letters. Some people get injury to areas in their left language centers and then develop dyslexia. Left-right disorder, inability to tell left from right. So intelligence is no way related to the phonological processing part of dyslexia. That is not a factor at all. And another myth about dyslexia is that mirror writing is a symptom of dyslexia. And in fact, backwards writing and reversals of letters of words are commonly in the early stages of writing development among dyslexic and non-dyslexics. This happens in early stages of normal development. So that's something you should know. Now, if someone has mirror writing, you should definitely keep an eye on it, but it doesn't confirm the diagnosis of dyslexia. Dyslexia is really problems with the phonome. The phonome is the smallest unit of sound that distinguishes one word from another word in language. So most dyslexics, when they speak, you have no idea that they're dyslexic. So to them, they could just be hieroglyphics that are completely different from each other. They have a hard time putting those associations together. So most children and adults that have dyslexia, when they're reading, it's like they're running uphill with their mind. They're like, have weights on top of their brain and they're running uphill. Cognitively, they're being significantly challenged because, again, think about trying to learn how to read when this is how you're processing language and letters. Speaking is carried out on an automatic and unconscious level by biologically determined phonological models in the brain, so no problem whatsoever. Reading is not automatic, must be learned. But children that have skill of phonological awareness are typically dyslexic. So difficulties in learning to read, phonological deficits persist into adulthood, and instruction in phonological awareness promotes the acquisition of reading skills. So when you look at dyslexia in elementary school, and you look at initial learning elementary school, education is focused on decoding single words. So right when they start their education, they're having a really hard time in school, and they realize they can't do what other kids are doing. And this has been shown to dramatically cause children with dyslexia to have self-doubt, emotional stress, depression, anxiety, hate school, not be in social environments, the way their brain is wired. 80% of dyslexics are genetic, primary. Their neurons haven't migrated in these language centers, so that this is how they're now wired. Now, the interesting thing is there's different theories of dyslexia. Some neurodevelopmental researchers believe this is a part of just somehow some brains develop, that we have different types of brains as human species. So some of the most highly contributing people to the human society are dyslexic. They have different brains. So the brains are wired differently. And these brains are learning language differently, but they become extremely creative and can think in different ways. If there's lack of development in language centers, there can be some dyslexia that may change, but genetically acquired dyslexia is something that is basically a different brain architecture. What's very interesting is these language areas of the brain are different in boys and girls. When men get left inferior parietal lobe injuries, like an acquired dyslexia, they have some significant compromise, let's say from brain injury. But if a woman gets the same injury, they usually don't get dyslexia because the other part of their brain can function. Okay. So with dyslexia, there's different forms depending on which regions of their brain get involved. You find it difficult to say the months of the year forward in a fluent manner. You find it difficult to say the months of the year backwards. Do you mix up dates and times and miss appointments? When writing checks, do you frequently find yourself making mistakes? Do you find forms difficult and confusing? You have to realize when people have dyslexia, their brain gets fatigued and tired, and they don't even know they have it. They may actually be dyslexic. That could be part of the reason why they're having depression and brain fatigue issues. Make sure their blood sugar levels stable. Make sure they have good nutrition for their brain. Make sure they have healthy fatty acids. If someone has dyslexia, if it's genetic or acquired, and if it's acquired, then all the things you would normally do for brain rehabilitation and language will help get those neurons to grow. And be quite honest, with these learning disorders, the best people to treat them and manage them is their occupational therapist. So when a kid's brain is not developing well, that's when you have to do your functional medicine workup and then figure out what metabolic biochemical factors are getting in the way. So the sort of like sensory overresponsivity. Many of them can't handle like the tag of the t-shirt. Like all the tags or t-shirts have to be taken off because it just feels like there's a knife on their back. Another key feature is sensory seeking or craving stimulation. So the craving for a sensory experience, like a really common one is spinning. And this will almost tell you what you need to do just to help the brain develop. So I go, hey, you having fun? He's like, yeah. And then I spun him the other way to the left and he lost his mind. And then when we did some further testing, we checked his cerebellum, checked Romberg, similar test. His right cerebellum was totally not working. So as a matter of fact, as a clinician, as a parent, if you see sensory stimulating activity where they're craving a certain stimulus to constantly do over and over again, that's probably what they need to activate their brain. Usually with those children, if you do like pinwheel testing, they just don't feel stuff there. And as they activate that area of the brain, it starts to light up the brain, and that's something that people seek. So sensory seeking behavior is a good clue of what kind of therapies they should be engaged in, what areas of the brain may not be working. The worst thing you could do is have someone bad at something and then not have them do it anymore. And then that area of their brain never develops, right? People always go like, why do you neurorehabilitate a child with development disorders? You make it really simple. Whatever they can't do, you have them do. Whatever they're having difficulties with. And there's simple motor tics like eye blinking, head jerking, shoulder shrugging, eye darting. And there's complex motor tics like touching the nose, flopping the arms, shaking the head, touching other people. And actually, when they suppress the urge, it gets much, much more dramatic and much, much worse. So people that have motor tics and vocal tics that continue, they actually become more and more efficient. Just if you're practicing a baseball swing or golf swing over and over again, it gets more efficient over time. Stemming is a phenomenon that occurs in autism. Is when they're getting a lot of stimulation, they'll do something like move with their arms or with their hands. They're so excited. And that's just a way to handle their input. Now, there's kids that develop something called PANDAS or PANS, where they have an infection, and then the infection produces antibodies, and the antibodies from those infections cross-react because they have molecular mimicry to the proteins of the pathogen, specifically with the brain. And then kids like overnight can get vocal tics, motor tics, anxiety, OCD from the infection. And as soon as they get put on anti-inflammatories or antibiotics, their symptoms immediately stop. Those are the areas of the basal ganglia not dampening the limbic system. Limbic system is the emotional brain. It's where you have fear, anxiety, aggressiveness. And with kids that have injury to the basal ganglia or their frontal lobe isn't activating the basal ganglia to inhibit the limbic system. And if there's lots of inflammation, in fact, in the frontal lobe or things that are increasing neurotransmission, then that can cause depression unrelated to a known cause, psychological cause. Separation anxiety is a huge issue with childhood developmental disorders. Fears of specific things happening to them, like they're going to eat their food and choke, someone poisoned their food, something bad's going to happen to mom when she goes outside the room. You realize that there's lots of ways, that the brain can express itself when it's not developing properly. You could have someone that develops pediatric acute onset neuropsychiatric disorder where they have an infection that injures the basal ganglia, and overnight they have symptoms. So when you're working up a child that you suspect, or the parents tell you that they have child developmental disorder, I put together a sheet that will help you not miss any of the things that we talked about. Now, you could literally take this form with the parent and go, hey, I know your kid has been diagnosed with whatever, let's say ADHD. What I want to do is just determine all the different types of regions of developmental disorders that may take place. So one of the things you want to do is you want to be thorough. You want to identify all the things that are off, because ADHD doesn't mean really much. It's just some attention issues and maybe some hyperactivity, impulsivity, what specifically it's involved, and the depth of different areas of the brain that are involved. Genetic dyslexia and autism are happening prenatally. There's neuron migration issues. That's the main feature. And neurological pathways have not migrated to the same area, so the brain architecture is different. But at the same time, if you have a child that is suffering from severe autism, if you can calm down their brain inflammation, if you can figure out ways to remove reactive foods, if you can teach parents, hey, these are sensory overloads. This is just giving you the blueprint of what's happening with the brain and what patterns are not developing.